I'm Dr. Msandeni Chiume. I'm a pediatrician by training and newborn technical lead in the Ministry of Health of Malawi, but also the Newborn Essential Solutions and Technology NEST 360 country lead for Malawi. We've been taking a systems approach to improving newborn care in Malawi, and this has included several components: data systems, equipment, human resources, thinking through the financing aspects, quality improvement initiatives, and a couple others. But let me start with the equipment aspect. Malawi was a setting where a few years back, before NEST 360, we didn't have any equipment in the neonatal ward, so we provided basic newborn care, including following some structures like essential newborn care, but that was not sufficient, as you can imagine, and so an initiative came through providing a bundle of equipment or technologies to support newborn care. This was an exciting moment for people like me who had been trained in places where it was full of equipment in neonatal units. We embraced the initiative, we were energized by the approach, and we began implementing a bundle of technologies that included support, warmth and support for the newborns, support for its breathing, temperature management, and a couple of other things. But with that equipment, as you know, many people donate equipment, but that equipment easily falls apart and ends up in an equipment graveyard. We've been very fortunate with the NEST 360 approach that incorporates a learning between biomedical engineers and clinicians, and that allows for skills transfer and good collaboration between the two systems, but also allows for a longer lifespan for the equipment that we received as donations. As we speak, over 90% of our devices that we installed over 5 years ago are still alive and really being used to support these babies. And I think that's a good example of system strengthening long-term and thinking about sustainability. But alongside that, it was not enough to bring equipment in a place where we are naive about equipment. Training and capacity building was essential. And in this regard, we then thought about the whole systems approach again, and then started from basic training in the nursing schools, making sure that people are equipped with the right information and knowledge about how to use the equipment, when to use it, and even how to clean it and follow up the care of the equipment. Not just nursing schools, but also medical schools. And so we were building a cohort of individuals that would not be shocked when they're in their work environment. In the meantime, there were still babies or nurses and clinicians that were taking care of babies and receiving these equipment. So we needed to engage them and make sure that they're brought up to speed. So we also did on-job training or on-site training to make sure that these the equipment are well understood by the healthcare workers. And over time, we believe that there's been a blend now, and there's now equipment, understanding on how to use equipment, but also not just equipment. I know I'm focused on equipment. Care in the newborn has changed dramatically by not just focusing on equipment, but even practical experiences of improving hypothermia, for example, how you dry babies, how you resuscitate babies, and just a basic comprehensive newborn care as described by the World Health Organization at level 2. We believe that setting up the basic training and providing equipment provides a good foundation, but over time, to improve quality of care of the newborns, we then began also thinking about the data systems. We were building the data systems, and we are fortunate that our government was very supportive about providing us government data clerks, which are in all facilities in Malawi, funded by the Ministry of Health. All we needed to do as NEST 360 is to train these people and bring the skills up to standard. And as you can imagine, that was very challenging, because you're really working with people who don't have the right skills. But over time, it was really, really rewarding, because these people remain in the system for a long time, and therefore tackling sustainability issues. Once we began working with the data systems, we found a real challenge of a slow turnaround time between the time the data is produced, which is at the patient discharge, to the time we can actually look at it in the dashboard, of over 49 days, 50 days. But now with quality improvement initiatives in the data system and data quality assurance approaches, we were able to reduce that turnaround time to 6 days. And that's now data that is timely, but also of good quality, and speaking to the needs of the clinicians in the ward and being able to support the clinicians usefully. And then over time, we started to now build the system to develop a culture of quality improvement initiatives. A culture when people can sit around desks and review their own data. A culture where people are not afraid to come to conferences and present on their data and really be critiqued by others without taking shame or blame. And really being also open to share quality ideas with others that they've learned during implementation. This approach has really allowed for growth and energized approaches within the facility. So we're there feeling very contented about some of these efforts that we're doing to strengthen our system in terms of newborn care solutions. But through this process, be honest, I learned a lot. I have learned that really it's about collaboration. It's about having the right people in the right places, starting from knowledge generation and synthesis of the knowledge, and then trickling down to implementation, thinking, and government support. When you have the right advocates within the government, then your agenda is easier to take off. And then you shift from there, if you have the support, going down to the implementers. When you have the right key people who are energized and willing to learn, anything is possible. And then it's about creating teams, and it's about trusting each other and supporting each other, learning from everyone that is existing, from a bottom-up approach even to a top-down approach. Both ways, allowing the system to speak to you and drive that change together. I think that's been the greatest learning for me.